Okay, this video is about, this is the next part. I think this is part 4 of how to prevent a heart attack. I'm just going to show you a little epidemiology because a lot of people, rightfully so, they'll say, we hear contradictory information. How can we know what the truth is? You'll have a pair of so-called experts saying almost the opposite thing. One says eat a high-fat diet, other says eat a low-fat diet. And what I'm trying to tell you is that the epidemiology don't lie to you. Tarahumara live in northern Mexico. They used to be combined with the Pima. After the Mexican-American War, 1848, the Pima got sucked into Arizona, and they now eat the standard American diet. They're really fat and really sick. Tons of hypertension, diabetes, coronary artery disease. They often end up with leg amputations from diabetes, gallbladder surgery, open heart surgery for coronary artery disease, etc. Whereas the Tarahumara eat the old-fashioned corn-based diet. They live in northern Mexico. Tarahumara means like fleet runner. Sierra means like a saw. The Sierra Madre Mountains, the upper parts look like a saw in Copper Canyon area. They don't even have cars. They're world famous ultra marathoners. So the point I'm saying is that's how it is. In these, backward places, a lot of them illiterate. They know more about preventing coronary artery disease, hypertension, and diabetes and obesity than these, Ivy League trained doctors. You eat the low fat starch, potatoes, sweet potatoes, white rice, beans, corn, whole grains. You got a skinny population with open arteries. That's what you want. And it's always like that, Yanomamo in South America. Here's a Yanomamo. Okay, now these guys are kind of wild and crazy. They live in Brazil along the border with Venezuela, Amazon jungle. And they run around. There's a whole bunch of little Yanomamo tribes. And they go and they fight the other tribe and they try to steal their women. So it's a pretty stressful life, kidnapping women. But despite all that, they got clean coronaries, okay, and they don't get diabetes and hypertension because they eat a plant-based diet. So what I'm trying to say is diet's more important than stress. And again, I find it funny that these illiterate guys that are sort of violent and crazy know more about preventing coronary artery disease and diabetes and hypertension than Ivy League doctors. That's funny. It is, because Ivy League doctors think they know everything. And they don't even know what these illiterate people know. Okay, here's high blood pressure. The reason you have a blood pressure, get blood to your brain, pumping it against gravity. Normal blood pressure is something like 110/70. As long as you feel good, you can have a lower pressure even than that. Here'd be severe hypertension, 200/100. The top number is called systolic, means Greek for contraction. The bottom number is called diastolic, Greek for relaxation. Okay, the difference between the top and the bottom number is called the pulse pressure. The ascending thoracic aorta is called the second heart. So when the left ventricle contracts, it pushes blood into the ascending thoracic aorta, which is then stretched outward by the pressure of the contraction. And during diastole, relaxation of the heart, the ascending thoracic aorta elastic fibers will recoil inward, and then that will propel the blood during diastole. So this is called a Windkessel effect. It means like that word, like in German, looks like a little accordion. You push it like this, and you blow air on the kindling of a fire. That's the Windkessel. Okay, so anyways, after you've been hypertensive for a couple decades, you burn out these elastic fibers. They're destroyed, and you can't get them back. You don't grow them back after 20 years of age. So the typical person who's hypertensive, starting in their 20s from eating high-fat diets and having a lot of caffeine and becoming obese, they're going to destroy their Windkessel effect, and it's going to be gone by the time they're, in their 30s, 40s. And then they just keep getting more and more systolic hypertension because they're not generating enough diastolic flow. This is why older people have more systolic hypertension rather than diastolic hypertension. The normal endothelial cells are spindle-shaped, orientated along the long axis of flow. Okay, here's normal laminar flow. And they can sense the direction of flow too. They expect it to be in this direction here. This is laminar flow. It's like your hand. Imagine your hand. In the center is the red blood vessels with these red arrows. They flow faster, okay? Next to them are the blue arrows. That's the white blood cells. Where my thumbs are, that's the plasma. So the plasma is located adjacent to the wall of the artery, the endothelium. Again, the red blood cells are about 5 microns. Capillary diameters, the red blood cells are about 7 microns. Capillary diameter is about 5 microns. And then if you have them stuck together because you're eating a high-fat diet, you got high LDL cholesterol, high triglycerides, high chylomicrons, and they're stuck together. It's like pushing a submarine sandwich through these capillaries. Pressure has to go up, and if you vasoconstrict them from high dietary sodium, pressure has to go up more. If you got a whole bunch of leaky gut with all those clots, pressure goes up more. Okay. When the blood pressure comes up through the artery, it's going to hit the dividing wall at a bifurcation. So here's the external carotid. My fingers would be the external carotid going to the face. Internal carotid going up to the brain inside the skull. When there's an excessive amount of systolic pressure, you get more and more of it bouncing off the median divider at a bifurcation, and then it goes backwards. That's called retrograde flow or eddy currents, and it also have chaotic flow. That's called turbulence. The more turbulence and retrograde flow you have, the more clot will form on the far wall. It'll actually have an antithrombotic coating on the arteries called a glycocalyx, and when you have excessive amounts of abnormal flow, it senses that as a vascular injury, and it'll shed the antithrombotic glycocalyx, and you'll have prothrombotic cells sitting below there like VCAM, vascular cell adhesion molecule, and a clot will form. This is where it always forms, opposite the bifurcation. I've seen many tens of thousands of CT angiograms, MRI angiograms, catheter arteriograms. This is where it always is, opposite the bifurcation, because that's where you have the most turbulent flow, retrograde eddy flow, especially retrograde eddy flow, and clots will form there. Okay, and that's why hypertension is a major risk factor for atherosclerosis. Oh, here's one thing Esselstyn will talk about. When you eat the plant greens, they come in as nitrates, NO3. The bacteria on your tongue convert them to nitrites, NO2. And then they go to the stomach, and the stomach acid converts them to nitric oxide, NO, nitrogen and then oxygen. And then they travel through your body. The nitric oxide is a stomach vasodilator. It can also travel along red blood cells. All right, it's a gas. If you eat something that damages these mouth bacteria like fluoride toothpaste, fluoride mouthwash, fluoridated water, or you're taking oral antibiotics, you'll kill these bacteria in the back of your tongue, and then you won't be able to make this first conversion step from NO3 to NO2, and that'll increase your risk of hypertension because you lose that systemic vasodilation. If you're taking proton pump inhibitors and you're wiping out your gastric acid in your stomach or antacids, then you won't get this conversion step from NO2 to NO, and that'll also increase your risk of hypertension. This is a plasma membrane ion pump, sodium potassium ATP pump. And these maintain the ionic gradients of the plasma membrane like at around negative 65 millivolt. They're pumping in 2 potassium, pumping out 3 sodium, so there's a net outward flow of positive charge. That's an electrical current. There's a charge separation across the plasma membrane barrier like a capacitor. Okay, so this is an electrical battery is how it functions. All right, you always need magnesium. We're going to get to that later, but whenever you have an ATP reaction, you need magnesium in there. You're going to build up a gradient where there's 10 times as much sodium outside than inside the cell. And you can harvest that gradient by allowing sodium to come into the cell and couple that to pumping calcium outside the cell, because you always need energy to pump calcium outside the cell. We're going to come back to this all in a second, but the key point is this builds up gradients that can be harvested to pump other things. And calcium is going to end up being the most important ion in the cytoplasm that needs to be controlled. Okay, here is magnesium, and magnesium, in terms of having a nickname, is the hero. Magnesium is located in the center of chlorophyll, so you eat the plants, like your leafy greens, you'll get that magnesium. Magnesium is a hero because it hangs on to the second and third phosphate in ADP, adenosine triphosphate. Adenosine triphosphate, ATP, is like the $20 bill inside a cell. And in order to control those phosphates, they got like a double negative charge on them. They want to break apart from each other. You need that magnesium there to stabilize them, okay? Okay, now here is God designing the earth, okay? And I'm going to tell you, it's very valuable to understand this. And the way I teach it, I'll use God and the metaphor of God creating life on earth, because I think that's probably what happened. And not only is it probably what happened, it also makes it much, much easier to understand this stuff. So God designing the earth, he started by creating life in the seawater, the origin of life. And the seawater is salt water. Okay, you need to remember that. Salt is sodium chloride. That's going to come up again. All right, and then the salt water would rinse over the rocks. The rocks are calcium carbonate, the limestone, and that would rinse calcium into the water. So you have to know that. Life on earth began in seawater. The seawater is high in sodium chloride and it's high in calcium. Forget about chloride because it just goes wherever the sodium does. But remember that it's going to be high in calcium, super high in calcium, constantly rinsing over these rocks. That's going to become essential to remember. And here's a nice painting, Creation of the Birds and Fishes by Gustave Doré. He was a great artist. He did a lot of good stuff in the 1800s. And here's the ion profile. An ion is a charged molecule. And here's what they look like. Extracellular means outside the cell. Sodium is high. Inside the cell, it's low. So you got a ton more sodium outside the cell, like about 14 to 1. Think of it as being at least 10 to 1. With potassium, it's the opposite. You're going to have high potassium in the cytoplasm and low outside. Okay. Calcium is like sodium. It's going to be high, 10,000 times higher in the extracellular space, and that's going to become relevant. So in order to create life on Earth within a cell, one had to begin by pumping out the sodium chloride and the calcium, enabling you thus to put new things inside the cell. I'll explain how all that works in a moment, but it's going to be a useful thing to know. All right, we're going to end right there for this session. We'll explain all the other stuff coming up real soon, how all the ions work, the ion pumps work, and how that relates to diet and nutrient labels and processing of food versus whole foods. Okay, hope you found that helpful.